Hello again, everyone. This lecture focuses on quantitative clinical assessment in social work. This particular module delves into the evidence-based practice, or EBP, process in its application in assessment. EBP involves converting information needs into specific EBP questions, conducting thorough research to find the best evidence, critically evaluating the evidence, and integrating it with clinical expertise and the client's unique characteristics and values. The effectiveness and efficiency of the chosen practice are then evaluated. While EBP has primarily focused on intervention selection, its relevance to evidence-based assessment, EBA, has been somewhat overlooked. Efforts have been made in psychology literature to address this gap, emphasizing the need for a strong foundation in EBA. However, recent studies reveal a disconnect between the intent to use EBA and its actual implementation among clinicians. Reasons include a lack of understanding of EBA benefits, concerns about it burdening clients, and time constraints. Nonetheless, increasing emphasis on accountability in mental health care underscores the importance of adopting assessment measures to enhance the quality of practice. There has been a significant growth in adoption of standardized assessment measures and computer-assisted technologies in social work and counseling. Empirically oriented practitioners prefer these tools due to their scientific approach. Standardized measures encompass various assessment tools, and computerized versions are becoming more prevalent. Standardization involves uniform administration and scoring procedures, ensuring comparability of results. Norms are established through a representative sample. Having the norms helps with scoring and interpretation. Rigorous research and development are required for standardization with varying levels of quality. In this lecture, I will talk about assessing reliability and validity, types of validity scoring, interpretation, treatment outcome assessment, computer-assisted tools, and limitations of standardized instruments. Reliability is a fundamental concept in the realm of assessment and measurement, focusing on the consistency, dependability, and stability of a given measure. In essence, a reliable assessment tool should yield consistent results upon repeated use. This reliability is often quantified through reliability coefficients, or standard error of measurement. These coefficients range from 0, no reliability, to 1, perfect reliability, with high values indicating stronger consistency. There are 4 primary types of reliability, and they're commonly talked about. Test-retest reliability. This assesses and measures stability over time by administering the same test to the same group on 2 separate occasions. It relies on correlation coefficients, and the timing between tests is crucial to avoid memory interference. Alternate form reliability involves providing 2 equivalent but different versions of the same measure to the same group. The correlation of scores from both versions is examined to establish reliability. It's often employed when creating shorter versions of scales. Split half reliability. This method splits a measure into 2 equivalent halves and then calculates the correlation between the scores obtained from each half. The challenge lies in determining how to divide the items effectively. Internal consistency reliability. Its internal consistency is assessed using coefficients like Cronbach alpha. It measures how consistently respondents perform or respond to items measuring the same construct. It is crucial for estimating the content validity of a measure. Reliability standards vary depending on the intended use. In group research, a reliability coefficient above 0.7 is often acceptable, whereas clinical work demands higher reliability, around 0.8 or greater, to guide individual client decisions. However, reliability alone does not guarantee validity, which is essential for ensuring a measure's clinical utility. Validity ensures that the measure accurately captures what it intends to assess. Validity in measurement is crucial as it ensures that a tool accurately measures what it's supposed to measure. 4 types of measurement validity are essential. Content validity. It ensures that items within a measurement accurately represent the intended domain or construct. Careful item selection is crucial to achieve content validity. Criterion validity examines how scores on a measure relate to a specific criterion, either concurrently existing criteria or predictively future criteria. It assesses the accuracy of a measure in categorizing or predicting behavior. Construct validity focuses on measuring theoretical constructs or traits and ensures that a measure accurately assesses these constructs. Construct validity helps confidently use a measure in practice as an indicator of client characteristics. Factorial analysis simplifies data by identifying underlying dimensions or traits within a set of items. It groups items that best capture the construct of interest, reducing the number of items. Validity standards suggest that coefficients between 0.4 to 0.6 are acceptable, but strict criteria should be avoided. Instead, validity coefficients should be considered in the context of similar measures intended for similar uses. Validity ensures that a measure accurately serves its intended purpose, making it a fundamental aspect of measurement. Incremental validity involves comparing standardized assessment measures to determine if one instrument can better predict a criterion than others. Its practical relevance lies in providing additional information that aids practitioners in selecting the most effective assessment instruments among many available for a specific purpose or population. Key questions include whether using standardized measures is worth the time and cost, whether multiple assessment methods are necessary, and whether data beyond diagnostic information is valuable, especially as most evidence-based interventions target specific diagnoses. Establishing incremental validity has gained importance with increased efforts to identify cost-effective assessment protocols making it likely that it will become the gold standard of validity in the evolving field of evidence-based assessment. Norms, scoring, and interpretation of measures are vital aspects of standardized assessment in social work practice. Norms offer insights into the typical performance over a specific client group, facilitating comparisons and understanding individual scores. Derived or standard scores are statistically converted from raw scores to allow the evaluation of a client's standing within the norm group. Standard scoring systems, including Z-scores, T-scores, and percentile ranks, enable meaningful comparisons across measures and clients. Cutting points indicate when a client transitions from normal to critical performance ranges. They are crucial in clinical assessment, helping identify the severity of conditions and the need for further evaluation and treatment. Percentile ranks reflect a client's position within the normative group, indicating the percentage of individuals scoring at or below the client's level. So if a client scored a percentile rank of 86, it would mean that they performed better than 86% of other clients in their norm group. Z-scores translate raw scores into standard scores with a mean of 0 and a standard deviation of 1. In other words, the Z-score tells us how far above or below the mean an individual score is, expressed in units of standard deviation, or SD. T-scores have a mean of 50 and a standard deviation of 10. For example, a raw score that is one standard deviation above its mean would be converted to a T-score of 60. Standard scores, such as T-scores, are widely used in psychological and clinical assessments with the purpose to achieve consistency in interpretation. They're especially valuable in instruments like the DSM-5 Level 2 measures for conditions like depression. Evaluating norms is critical. Norm groups must be representative, relevant, and of adequate size for meaningful comparisons. Using norms that align with the client's characteristics ensure accurate assessments and reliable decision-making in social work practice. It's essential to consider representativeness, size, and relevance when selecting the appropriate norm group for a particular client. This approach enhances the precision and validity of standardized measurement in social work practice. Another important step in the evidence-based practice process involves continuously monitoring the effectiveness of the chosen intervention. While practitioners select interventions based on the best available evidence and fit for the client, success is not guaranteed due to various factors. There will be still differences in how practitioners deliver the intervention. Clients might not be similar to the research sample, or the intervention itself might be ineffective. Therefore, ongoing assessment of client functioning and treatment response is crucial. Standardized assessment instruments, particularly rapid assessment tools, can facilitate this monitoring process. Key considerations in selecting such instruments include their length, sensitivity to change, and ability to identify clinically significant improvements. Standardized measures help track treatment progress and adjust interventions as needed. For example, trauma-focused cognitive behavioral therapy, TFCBT for children, uses standardized assessments to monitor post-traumatic stress disorder, PTSD, symptoms. The University of California, Los Angeles, UCLA PTSD Reaction Index assesses PTSD diagnostic criteria, while additional measures like the Strength and Difficulties Questionnaire, CDQ, and Child Behavior Checklist, CBCL, help assess co-occurring symptoms. In cases where time is limited, brief measures like the Patient Health Questionnaire 9, PHQ-9, for depression can be used weekly to monitor symptom changes. These assessments ensure that interventions are effective and enable adjustments to maximize treatment benefits for each client. Monitoring treatment outcomes aligns with the EBP's emphasis on ongoing assessment throughout the treatment process. In the field of mental health assessment, practitioners should stay informed about evolving trends. The DSM-5 offers a range of emerging measures for assessing mental health symptoms and severity. It includes level 1 and level 2 cross-cutting symptom measures that assess various domains like depression. These tools aid in identifying treatment priorities and tracking symptom changes over time. Additionally, personality inventories assess maladaptive personality traits defined in the DSM-5, including negative affect, detachment, antagonism, and disinhibition. Another significant development is the research domain criteria, RDOC, introduced by the National Institute of Mental Health, NIMH. RDOC adopts a holistic approach to mental health assessment, incorporating biological and behavioral measures across domains such as emotion, cognition, motivation, and social behaviors. These domains encompass various aspects and units of analysis. While ongoing research explores these domains, some assessment methods are becoming more practical for real-world application. Computer-assisted assessment technologies address the reliability and validity issues associated with practitioner-based assessments. Research indicates that computers often outperform clinicians in making clinical judgments, partly because practitioners lack time and resources for thorough assessment. Additionally, the absence of standardization in assessments result in inconsistent data and conclusions. Limited knowledge about community resources and admission criteria further complicates treatment decisions. These technologies are now more accessible due to their cost effectiveness and availability. We now have software and internet-based tools that can be used to administer, score, and interpret psychological and clinical measures like MMPI, MCMI, the Child Behavior Checklist, providing comprehensive client profiles and treatment recommendations. Expert systems and computer-assisted statistical decision models enhance decision-making, surpassing practitioners by approximately 10%. Adaptive testing tailors assessments for individuals, yielding quicker and more precise diagnosis. Quality assurance measures use norms and standardized tools to provide feedback on therapy outcomes, helping caseload management and treatment effectiveness decisions. Nevertheless, standardized assessment measures have limitations, including susceptibility to demand characteristics, narrow focus, potential pathologizing of clients, inability to prescribe treatment, and susceptibility to false positives and negatives. In the context of evidence-based assessment, EBA, and evidence-based practice, EBP, it is crucial to consider diversity issues during the assessment process. Diversity includes various factors such as age, gender, race, ethnicity, culture, disability, sexual orientation, language, and socioeconomic status, all of which can impact assessment accuracy, intervention choice, and treatment sensitivity. Ethnical and cultural differences are particularly important to address since research has shown variations in symptom expression and psychometric appropriateness among different cultural and ethnic groups. Standardized measurement instruments may exhibit bias against specific cultural and ethnic groups. To determine cultural bias, it's essential to assess linguistic equivalence, that is, ensuring questions are understood similarly in different languages. Conceptual equivalence, that is, ensuring questions convey the same meaning across cultures. And psychometric equivalence, that is, comparing scores across cultures. When these criteria are met, practitioners can confidently use culturally valid measures in conjunction with cultural formulation to align with EBA and culturally sensitive practice. However, cultural factors can still influence standardized measures' ability to identify distinct symptoms. For example, Western-based depression screeners may not account for differences in the perception of time in other cultures. Language barriers, interpreter trust issues, and cultural taboos around sensitive topics can also impact measurement validity. Using skilled interpreters and considering cultural nuances are essential steps in reducing potential measurement error. The assessment of comorbidity in clinical practice is common, with up to 45% of individuals diagnosed with certain disorders meeting criteria for additional diagnoses. Comorbid presentations are associated with greater impairment and physical health issues. Assessing comorbidity involves a multi-stage process beginning with a preliminary evaluation of symptoms and life context. Practitioners should select standardized measures based on their overall quality, including validity, reliability, and clinical relevance. Clinical utility or the practical advantages of a measure should be considered too, ensuring it addresses clinically relevant issues and they're easy to administer. Ethical considerations such as practitioner competence, confidentiality, and responsible use play a crucial role in the clinical utility of measures. Additionally, the societal context and potential biases within standardized measures should be acknowledged when selecting and using them. Ultimately, the choice of standardized measures should consider technical aspects, clinical utility, and ethical implications. When searching for the best standardized measures, there are valuable resources available. The American Psychological Association offers guidance on finding psychological tests. The Burr Center for Testing provides a searchable database with information on where to obtain various assessment measures. University libraries and interlibrary loans can help access instruments found in social science journals and sites. The Alcohol and Drug Abuse Institute at the University of Washington can help with locating screening and assessment tools for substance use. The American Psychological Association lists evidence-based assessments resources for pediatric psychology. The U.S. Department of Veteran Affairs National Center for PTSD offers information on trauma exposure and PTSD measures, including DSM-5 validated ones. Additionally, the U.S. Department of Health and Human Services National Institute on Aging assists in identifying measures to assess cognitive impairment in older adults. Multiple other websites and books offer extensive information on rapid assessment instruments and psychological measures.